Hello everyone, this is Shad Reis from the Itw Medical Center. This is Arch 2022. With me is Dr. Rafi Khan. He is Interventional Cardiology Fellow at St. Louis University, and he is graduating pretty soon.
Yeah.
Dr. Khan, thanks for being with us.
Oh, thank you. It's exciting to be here.
Yeah, so congrats for the new job.
Thank you.
And you're finishing up the final stretch now of training.
Right.
So tell us about choosing jobs. What makes you go to academic versus non-academic job?
Okay, yeah. So I think when you first finish interventional, or you're in your interventional year, you're looking for a position. For me, it was a lot had to do with family. My wife's actually a resident at University of Louisville, so I was looking to stay locally around that area. But in terms of academic versus private, that's a big discussion too. I interviewed several places, both private and academic, and in terms of academic, the University of Louisville offers heart transplant center. They offer a lot of advanced technologies where private sectors might not be able to do that. Yeah. So coming out of interventional training, for me, it was important for me to be able to continue complex lesions, especially early on in my career.
Right. So what are you feel the challenges as an early career when you're graduating? Now you're finishing up, you have boards coming up, then you have to build your practice,
right,
and then sharpen your skills,
right,
and so learn things. So how are you gonna? Do you have a plan, or is something going to be
So it's difficult. It's probably one of the more stressful endeavors. I think when you're in interventional training, it's a little bit easier because you always have an attending by your side. Yeah. And the biggest challenge is knowing that you may not have that type of support.
Right.
So when you're looking for a job, you're really looking for a place that will offer you that support, especially early on, because there's a lot of, in the interventional field, there's a lot of things that you may not see within 1 year. Yeah. So I think the biggest challenge for me is knowing that, in a few months' time, I may not have that support. Right. In the middle of the night, STEMI, a complex patient, a crashing patient, you may not have the opportunity just to call a colleague, yeah, or you may not have an attending, right by your side to make those decisions. So I think that's the biggest difficulty in the transition. Yeah. Yeah.
So how do you spare your spare time?
My spare time is mostly gym, basketball, and listening to whatever my wife wants me to do. So she makes the rules. Yeah.
Smart. So this is your first time at Arch?
So I attended the mini session in October, but this is my first time in Arch. Yes.
How do you think so far?
It's great. I mean, I think it offers a vast array of both the technology and both it goes over peripheral, structural, complex coronaries. It's a good refresher. Early on. Back in October, I wasn't well versed in all the wires, the complex coronaries, the different technology, but now that I've seen it more and I've gotten used to more, it's more of a refresher, and it allows me to ask the proper questions that I need to ask.
Right, yeah. Well, thanks for being with us. Good luck with the job.
Oh, thank you very much.
Yeah, please watch this video and others on Arch YouTube channel. This is Shad Reis from Arch 2022.